Good afternoon and welcome. My name is Monica Harry. I'm the Director of Content and Mapping for SNOMED International, and I'm happy to present the third session this afternoon. In this particular set of sessions, I'll call them, stream, enhancing clinical practice and outcomes. And our next presenter is Sarah Harry. And Sarah will be talking about constrained ontology for pathology and laboratory medicine and interdomain reporting variations and the impact on lab standardization efforts in SNOMED CT. Sarah is a senior terminology specialist with Termlex. Welcome, Sarah.
Very much, everybody. I need to talk through this. If that's the case, I can't quite see the screen.
There's a handheld mic, yeah, up there.
I do have to click outside.
Great.
It's okay. Hands. Okay, let's see. My mind tends to blank, so I better have something to refer to in case it does. I'm really just starting with something from Marcus Aurelius, which I couldn't resist sharing. I think it's a great quote. I'm not sure if I need to read out the whole thing myself. Take a while, but 2,000 years ago, he was saying a definitional delineation we've made of every object that presents itself to us, so that we see what sort of thing it is in its essence, stripped of its adjuncts. And he says, for nothing is so conducive to greatness of mind as the ability to examine systematically and honestly everything that meets us in life, regard those things always in such a way as to form a conception of the kind of universe they belong to, use of things and questions subserves in it, what value it has for the universe, and what command. It's just brilliant stuff. I just thought I'd share. I'm not sure if it's actually necessarily relevant, but it's a good, great flavor. So
I think you have to point to the back. Sorry, I think them. Press. Oh, one too far.
No, we have. Great. Okay. So this is, in a sense, one in a series I've spoken before about. I've talked about intermediate formalisms for SNOMED in the lab world in terms of test descriptions, including patient-friendly descriptions, or possibly friendly descriptions, shall I say. I've also talked about categorizations for categorization strategies for lab content. So this is kind of part 3. Here I'm looking at the possible differences across domains in the lab world. Do they matter if they are actually there? Okay. Yeah. This is a horribly simplified view of the lab world, and I'm not sure everybody is necessarily on the same page. So just very briefly, I'll just try and conceptualize the whole of that lab world, particularly from a blood sciences perspective. If you see the middle layer, there's 3 layers. There's a middle layer there, the info layer, which has a request for a test. There is, on the right-hand side, there's a result, there's an interpretation of that result, there's a relationship with that red line between the request and the result. There may be an interpretation of the interpretation, we'll see. In the middle, we've got a lab performables black box. So I'm not going there. I'm not going to talk about things that are actually done in the lab. A lot of that could be SNOMEDized. Some of it can't be SNOMEDized. It's best to just say there's a request that goes in, some magic happens, and a result comes out for the purposes of what we're looking at in terms of SNOMED results. It's in the SNOMED layer at the bottom. The request is represented in procedure terms, a SNOMED procedure. On the right, we've got results, and those are identified by observable entities with a value attached to them, and may or may not be then represented as clinical findings. At the top, we've got the tech layer, so there's two systems. So there's an order.com system that handles the request, and a LIMS system, laboratory information system, that handles the results side. So in a nutshell, I hope we all kind of know what we're talking about here. Okay, I think that probably covers it. So what did we try and do? Well, we already know SNOMED can do this stuff. There's plenty of work being done on the histopathology and cellular pathology side. There's a whole lot of work being done on blood sciences too. There's certain overlaps with other things in the world, but let's not go there. But in terms of what we tried to do here was really just to see if there are any blockers here for modeling content anywhere in the lab world, anywhere where there's a problem. Are there potential issues? And those might be things like the large number of combinations of content. So we've got lots of sites and lots of methods, lots of specimens. And when you start to add all those together, you end up with large numbers of content. Is that an issue? Well, arguably not. We might well have, I mean, it's called a combinatorial explosion, but maybe that's not such a big deal. And certainly if we start to analyze that, we might find that some of those things don't need to be done. And we must remember the information layer with all this as well. It's not just about representing these SNOMED concepts. SNOMED scope issues, so there may be things that really we shouldn't be doing in SNOMED perhaps. So those might be arguments still up for discussion, things like mutations, things like devices. There might be things that we shouldn't be including, flags and statuses on tests. There's a number of things. Uncodable detail in text reports. So if we've got prose that we find difficult to represent, we'll have to just come back from that. Modeling issues within SNOMED. So within scope, but we're lacking the ability to actually define content in SNOMED. So what did we do? What you might expect, really. We had some large lists of lab tests extracted from systems. They're from large regional hospitals where we were using some data from Scotland, from the Scottish regions. And they were really useful. What we were trying to do, of course, was in terms of our applications, was to see how we can actually represent the whole of the content consistently across the board. So we reviewed the domains, we split everything up, we looked at the blood sciences model, which I'll describe in a sec. We looked at what we can try and do as a parsimonious model, if you like. What is the minimum set of things you need in order to define something? And then you can bolt on lots of things on top of that. And I use the word canonical, and I'll get crushed by people who know more about the word canonical than I do. But it's a way, it's just for me to describe trying to minimize what we have to describe in a test concept. We look for unmodelable content, we look for issues with domain-specific patterns, and with what you might expect, really, and see if there are any blockers. But why would we do that? Why would we go through all that effort? Why not just work through the lists and code it all, or not code it all? It's consistency. Of course, you're very familiar with these things already. At the information level and in systems, we shouldn't have to accommodate exceptions. We shouldn't have to add in extra steps to transform something in one domain because that's an outlier and they do things slightly differently. Actually, that's worthy of challenge, and see whether we can actually bring everything in together. That doesn't mean we have to be dictatorial and say everything must be the same, but I'd like to see a very good reason why there's a particular domain that has to do things in a different way. And we've also heard recently about the need to represent SNOMED not solely as pre-coordinated concepts, but also as expressions. And those expressions allow us to do a lot more transformation on the content. And and supports interoperability. And again, those expressions should be consistent. They can't be just jumbled bags of codes. They need to come out at the other end the same as they beginning. So it's important that those expressions are held together properly. And we're trying to be agnostic, really. When we're trying to build expressions, we're thinking in terms of using the SNOMED ontology, but whether it actually ends up as a SNOMED code or ends up as something in like, well, we're agnostic to that, but we just want something to make sure that we're consistent about that. What are we talking about? Just briefly in terms of domains. Talking about if people are familiar with these things, and I think these are Royal College of Pathologists definitions for blood sciences, and that will be clinical chemistry, biochemistry, hematology, andrology, immunology, the sorts of things that are autoimmunity and allergy, particularly blood bank transfusion, histocompatibility, microbiology. And that really can be broken down in terms of culture and sensitivities, antigens and antibodies, and nucleic acids. So we can look at those. The omics, the genomics, and the rest of those things that will come along. Histology and cellular pathology, which of course is a big area of in itself. What I tried to do was just make this simpler. Just shift blood bank into under blood sciences. So blood sciences gets everything lumped in together underneath it, really, because we can apply the same pattern no matter what it is. We've got a component and a property and a system, so it's all the same. Just to simplify things, and I've knocked histocompatibility out. And I used to be a transplant nurse, so I don't really want to knock this out. And I actually have done some work on tissue typing and and how it could be SNOMEDized in terms of cross matches and full houses and all sorts of things like that. But that's not for here. It's a small area. We'll leave it one side. And I think we can just leave the rest as they are. So that's what we're looking at, those major areas. Okay. Saying that they're canonical, I'll get in trouble for that. But what I'm trying to do here, I see a lot of extensive modeling. When we're looking at content that's being worked up, every attribute gets a definition, and there seems to be a drive to define everything as much as possible, rather than say, what do we actually need as a minimum and then add things on. I'd rather, that's maybe just a personal thing or a philosophical thing about how you actually model content. But for me, it's a way of actually keeping things simple and only adding complexity when we need to, rather than starting off with complex model content. So what we've got here, I've been through these sorts of things before, and a lot of you'll all be familiar with this, really. But essentially, from an ontological point of view, we have a thing, which is often a component in SNOMED. We have a property of that thing. That's actually a quality in ontology terms, and a quantity is a quality as well. They're not alternatives. And there's the system that the thing is in. I've added on method, but that's not actually a core part of this. It's just a reminder that we've got that on the side as well. But that we've got that essential three things. And that's essentially fundamental. Can we dig a bit deeper into that? If we look at those three things, thing, property of thing, system thing is in. If you take, you can have a property of a thing, and you can have a property of a system. In a sense, that turns the system into a thing as well, really. So that works. But if you try and have a thing and a system, that doesn't work anymore. What you have to have is a property. So I'm getting down to more fundamental things here. What is it that you have to say about a thing? There has to be a property. And maybe that seems obvious, but if you don't have that, all the stuff around inherent locations and pre-coordinate preconditions and all the rest, none of that matters if we don't have an essential there. So I would call that properties in really. So okay. And so some examples of that, and I really don't spend too much time, so I'll be running out of time if I'm not careful. Some examples, these are UK lab extension concepts, and we can apply those things throughout. So you can see that there's things, so there's sodium, neutrophils, von Willebrand factor, CD cell antigens, glomerular basement membrane antibody. So we've got a property, substance concentration, count, arbitrary concentration, more counts and amounts, basically. And then we've got a system, so these are pretty specimen or body system, serum, that's what we can do the same, microbiology, exactly the same. So we're looking at nucleic acids, antigens, antibodies, all easy stuff, bread and butter stuff. It seems so to me, sometimes maybe I'm just too immersed in it. So we have Epstein-Barr virus, we have an RNA, we have a Staph aureus, dengue virus, IgG, and we have property. And every time there's a property, number, concentration, qualitative result, titer. Here we have a couple of systems. So we have serum, the antibody ones, but we don't have systems for these two. The number concentration on Epstein-Barr virus, but that's a nucleic acid application and this qualitative result. Now, I'm not sure why that is, but it's certainly underspecified, underdefined in the UK. And I think that there's two possibilities there, but I'll talk about that in a second. Let's look at some more microbiology. These are things, this is a screenshot from our application, PathNexus, where we can actually do some of this work. And what we've actually done is embedded the SNOMED model in the application. So we've got the whole SNOMED model there available, but we only model what we need to model to define. And here we've got E. coli, and we've got a colony count in blood. All we do is select this E. coli here, and it'll create the concept for us. It'll do the syntax, so it's colony-forming unit count in blood, FSN, and it'll do a friendly term down here, which can be modified to how you want it to look in your particular variant. Save, and you've got a concept. So basically, that's my termy brain loaded up into there, and a clinician can come along and create a new concept here, and it is entirely SNOMED compliant because it is SNOMED code. Another one, gram stain. Here, I think I've just put bacteria. It says bacterium, bacteria, and this is saying that there's it's an observable entity for what gram stain is in a surgical wound swab. Then you can actually then have another code that says it's a gram positive or gram negative code bacteria. And all you have to do again is to select the component, select the specimen, create the concept, and you've done. And it's the same model, and it's all done for you. Again, antimicrobial susceptibility. There's a slight variation here, but again, we've got Pseudomonas, and we just want to say that it's Pseudomonas susceptibility to vancomycin. These are just examples, and you may say, well, that's rubbish, wouldn't do that, but whatever. Slightly different property, we're using towards, but we're still using pretty much the same thing, and you can create your content on the fly here in this. So we've applied the SNOMED model here, and we've automated the description process for this. These can be created on the fly, or they can be created as concepts which are stored. And if they're created on the fly, they can be used not solely with our SNOMED concepts, but they can be used as joint concepts. We can actually break them out into the separate components and put into an information model layer. So you can actually put all the detail that I heard you talking about earlier on around the cellular pathology content. You can actually talk about tumor margins or grades and the rest if you don't want those all in one great big concept. you can actually still have an expression of that and just apply and put it somewhere else, so that you've still got that making sense within a frame on the screen. Okay, what have I got? So we can apply all that. So that doesn't make sense. So nucleic acids, antigens, gram stains, arrangements of cells under the microscope, sensitivity. So that's good. What works? Genomics and the rest, and histopathology. There's really too much here. There's no way I can go into this at the moment. I'll mention something around property attribute values, but I'll come to that a bit later. This is already being extremely well covered by our synoptic reporting people. And while we know that there are issues, everything actually conforms very straightforwardly to a SNOMED model. There's a lot of discussion to get it all nailed down, but I can't spend much more time on it here. All that I can say is it works. Scott and everyone else is demonstrating that. We've done a bit of work on that as well. We're looking at the genomics content as well, and essentially you can still apply the same sort of modeling to it. I've already said that we're creating that content on the fly, and you can contact us and talk. We can talk about it more. Genomics. So I'll really just say that this is partially historical, really. But what we would have done at one time would be to create a finding code, which would have been extremely detailed and with a fairly primitive, simple observable entity code like organism or carcinoma, mutation, disease, whatever, and then have all the detail on the right-hand side. So it's left-hand side, right-hand side of this equality. What we're now doing is we're now loading up the left-hand side of that much more. So we're using observable entities and using the full power of SNOMED to use to say it's an organism in detail. And describing exactly what that is, or what the carcinoma is, what the mutation is, and saying yes, whatever, not sure. And just an example there. So that we might have done something quite simple. There might even just be mutation in tissue or something as an observable entity, and then the details as defining it. Here's a detailed one in all its glory, and you can specify that potentially, although I know that's still up for debate, and you can just say, yeah, that's what this patient has. Is there an issue there? I think the only issue really is that the volume, the amount of work that might be necessary to get that to happen. Okay.
Zero, just a time check.
Yeah, I'm a short time. I probably was on actually. So I can say that there's we have issues around methods, around quantitations and interpretations, properties. There are some issues there which we need to address, but essentially the model works well. And I'll briefly go on. I've got time. Come on. Great. Methods, gaps in nucleic acids. We have things like calculations that seem odd and not necessarily all that useful. Things like INR calculation. I'm not really sure. They're not really all that well defined. Insufficient organization techniques for definition modeling. Calculation, not all the calculations are under calculation. Calculation techniques are under measurement, but they're not measurements. They're mixed with surgical techniques. There's a whole bunch of things there. In terms of, I think I missed that out. I was talking about properties. And this is important, really. Again, this hierarchy, a bit like things around methods and some other. We've got a property hierarchy, qualifier value hierarchy. It's got telephone number in it. Now that's not wrong because telephone number is a property. This used to be measurement property, and it had some things in it that shouldn't be under measurement property, so it's been changed. But what we have now is it's partially structured, but it's not well structured. It's missing lots of content. If you want to say a genotype, the genotype isn't a property. There's lots of things that you want to say as properties that aren't there. They're not structured. And I think this came up the other day in in the synoptics reporting as well, that it's all very well to fully define content, but if you're fully defining it by a big flat list of qualifier values, or this isn't a flat list, but it's not all that robust, then you're really only shifting the definition problem into this space. And really what we need to do, and I think there was mention of morphologies not being very well defined, in particular around genetics, and so genetic abnormalities, certain morphologies. So we need to be applying that here as well. We need to be doing some work so that we can actually structure these hierarchies in a much better way. And there are a couple of mechanisms of how that might be done, but it's really important to do it. I don't think it's just being neat and tidy. We have to be able to do this. And you can see the application we've got, it heavily dependent on having the right set of values to offer to people when the creation of content. As a terminologist, I would say that's rubbish, but a clinician would say, oh, well, I'll put telephone number in. Well, no problem, but you know what I mean? It's too free. And there are some residual issues around codes of quality control, machine calibration. Labs do all that. Why shouldn't we be coding that? As far as I'm concerned, they're reported in some form. Perhaps labs can get their accreditation controls for tests. So we've got clocking times. We should be able to add those as well. It's in the report. The control is X. So, and there's some other things that we can section. And so that's it really. Yes, it all works, which is good news. But there are some things which somebody said to me were pointy head sort of issues. Okay, I'm a pointy head, so you don't have to be pointy heads. Where we worry about methodology and how we can actually make that work better, so that as clinicians, you can actually do some of this stuff for yourselves. I think that's it. Sorry if I'm running.
No, that's okay. Any questions? Do you want to pass the microphone back, Sarah, just so we get that on the recording, please? Thanks.
Thank you. Thank you for this interesting talk. I thought internationally there is an agreement to use LOINC for test names and maybe SNOMED for qualitative test results. For years, that seems to be the international usual way to use standards. And listening to your talk, I become the impression that at the end, using LOINC is not longer necessary. Might be a choice to use SNOMED in a way that yes makes it possible to map to LOINC, okay, at the end, but not necessary to use LOINC.
Well, I can't speak for SNOMED International. Sorry, I'll put this on. Apologies.
Let's talk a bit, Sarah.
Let's talk.
Yeah.
Okay. Things are moving along in terms of those agreements. I don't think it's an either-or thing. I think what we can offer from SNOMED is that it's got an extremely robust model in terms of its ontology, its formal ontology, and its description logic, so that it actually, and that's a strength it has over LOINC. And LOINC is great for content. It's got lots of it, and it's got its own structure. But what we can do is potentially we can offer the strength of the SNOMED model to be able to have an expression or a concept which we in SNOMED, we can turn that into a LOINC expression too, into a LOINC concept. I don't think it's either or, and it wouldn't be possible really to do that. I think it's a mistake. I think the way I see it is that we've got something that's underlying that is the ontological truth of what the test is. And you can make that a SNOMED code, you can make that a LOINC code, but you can't do that unless you use SNOMED formality underneath it. And they're not comparable. SNOMED does everything. LOINC's got some very specific things it does very well, but they're not interchangeable, and I don't think you can swap them out that easily. They've got their own strengths. What we're doing is something that will allow you to use either agnostically, really.
Yeah, thank you.
Can we not just,
Another question? Go ahead.
can we not just reference the LOINC extension now?
Yeah.
Because a lot of that stuff that's in display today will predictably end up in a LOINC extension. I just wanted to comment on the examples that you showed of the microbiology, the nucleic acid tests. So those come from the UK National Release Centre from NHS Digital. Primary reason they're not pre-coordinated with systems, specimens, is because according to our microbiology subgroup of experts, you can take, as with cell path and histopath, you can take samples from potentially anywhere in the body. So we were reluctant to pre-coordinate all that stuff and,
Yes,
create,
yeah.
imagine there are common sites, obviously, that you could do, such as the COVID examples in the international edition, which have their pre-coordinated statements
Yeah.
about specimen.
I
But
skated
with-
over that.
I know, but I'm
what
just saying
I think is important there is to identify when you're talking about a system, are you talking about that this is a finding in the specimen? And then you would need to say what that specimen is, or
Yeah.
the site, or the swarm, or whatever. Or is this the finding of the patient? So if you're set, if it's hepatitis B surface antigen positive you found in that specimen, is that the same as saying this patient is hepatitis B surface antigen positive? And I think the system there is patient, and I think potentially there's two codes, or you can just use that code if you want to report that the patient is positive for something. But what we have is ambiguity about whether that's missing or just not explained. I think there's work to be done there, I think, in terms of teasing that apart.
Yeah, thanks, Sarah. Just quickly onto the question, when you were looking at the modeling, did you get to semi-quantitative resultables and looking at the model? Did you feel, if so, do you feel that the concept model in the observables hierarchy covers semi-quant sufficiently?
It does, but you don't have a value set for it. I think the trouble. There was 3 pluses, so that 3 pluses out of 5, 3 pluses out of 10, 3 out of 3. So I think unless you've got a better definition for those semi-quantitatives, it's not the work isn't done, but it's doable. I think the model works for it. Again, it's about adding more content that allows us to find things properly. But if you say 3 pluses, what do you mean? And it's not even linear, it's like negative trace 1 plus, things like that, what's that? We need more work left.
I'm going to cut you off there. I'm sorry, but if we don't leave now, other people may not get to their break in the next session, etc. So thank you so much for the presentation and the discussions. All very good. Thank you. And thank you, Sarah.
To talk about it,
Okay.
But Termlex booth down in the exhibition.
Okay. Thank you.